All right, so guess what, guys? This is your neck right here, and this part of your spine is essential. So many people are coming in these days with neck pain, and they want to know, can you help me with neck pain? What do I need to do about my neck pain? Because we're sitting on computers all the time. I can almost guarantee you, if you're watching this right now, you've experienced neck pain, or it's chronic for you, it's something you're dealing with on a regular basis. What I want to do today, though, is show you what I would do. You know, as a chiropractor who's been in practice now for 10 years, and we've helped thousands of people with neck pain. It's probably one of the easiest and one of the quickest things we can get change with. What we actually would do with that. So number one is I'm going to look at their spine and figure out why they have neck pain. Obviously, that's essential, right? What is the actual cause? I'm never going to say, hey, you have neck pain, try a muscle relaxer, try a painkiller, try ibuprofen, because that doesn't get to the cause, and it'll actually make the neck problem worse because those things deteriorate muscles and deteriorate the body. But when I look at the neck, imagine this is the head right here. When I look at the neck, you should have a curve in your neck, right? You should have a 40 to 45 degree curve in your neck backwards like this, and then your neck should be straight from the front. And then each one of these bones needs to be able to move, okay? So we should have full range of motion all the way through. It should be able to rotate and turn, flex and extend, right? So as long as all that's moving, you got a good structure in your spine, your body's gonna function well. You're not gonna have disc degeneration, you're not gonna have spinal nerve pains and things like that. You know, a lot of times the people will come in, they went to maybe a PT or something like that, and they say it's just a muscle issue. I'll tell you this, that if you have a neck pain that's on a chronic, regular basis, it's not a muscle issue. Muscle issues go away as your body heals. What's causing the muscle issue? Muscles don't just automatically start hurting or being sore. They become stressed because of positioning of the spine, right? So a great example is if you're like this, you have a loss of curve in your neck, your spine, your nerves are being irritated, but then also your muscles are being stretched. They're constantly being stretched and pulled. Well, you build little micro tears in those muscles, and the body puts down scar tissue. We call those knots and trigger points. Lactic acid, things like that will build up in there, and they become painful, and you become sore. But that's still not a muscle problem. That's the muscle responding to the postural and the spinal problem. So what we do is we address all those areas. So after doing evaluations in terms of looking at posture and seeing what the posture looks like, in terms of feeling the spine and seeing where the trigger points are, when the lack of movement is, and then after doing x-rays, we'll actually many times do motion x-rays where take a picture like this, take a picture like this, and take a picture looking straight, and then from the front with your mouth open so we can see that top bone in your neck. After doing those x-rays, then we have a big picture of what's going on in your neck. And once we've decided, okay, what you were seeing here is very correctable and we can help you, then we start actually doing care. And what chiropractic care looks like is very simple. A lot of people worry that it's like a ninja move, twisting the neck off, and it's actually not. It's very simple and it's very light, but it gets movement into the spine. You'll hear popping noises and things like that, and that's fine, but it's proprioceptive movement which blocks the stress response and gets rid of the inflammatory issues that are causing pain on those nerves, and it puts movement back into the spine. At the same time, we break up that scar tissue and those trigger points and then work on introducing the curve into the neck. Over time, we give you exercises that retrain the postural muscles, okay? So postural muscles are subconscious, right? So if you're a person like this and I tell you to stand up straight, you're gonna go like this. But how long are you actually gonna last like this? Like, I'm already tired just holding myself back because you're using big muscles. Those big muscles don't have longevity in terms of their ability to keep you in a position like your postural muscles do. Your postural muscles are small and they're also subconscious, meaning I'm standing right now and I'm not thinking about standing at all. My spine's just holding itself up because I have postural muscles that are doing that on their own subconsciously, right? They just automatically do it. And so those muscles have a memory. If you're someone like this, well, you've trained your muscles and your spinal muscles to be like this. They remember this position. We've all seen the old lady who's like completely hunched over, right? That's maybe been gardening her whole life and it's literally spine is stuck in that position. And then you have the dental hygienist at the same time who will see they're always bending over people, and you'll actually see that happen. This is huge with nurses because they're always bent over like this. But the sad part is we're seeing this in our kids. Kids are coming in with worse spines than adults, and they're finding disc degeneration in 20-year-olds now. Because a disc degenerates when your spine doesn't move. And so if you're feeling neck pain, that's a big deal. That tells us your spine is probably not moving very well. It tells us you probably have some postural issues or biomechanical issues. It also tells us that if we don't do something about that 10, 15 years from now or 20 years from now, that could be a degenerative change that happens in your neck, because if your spine doesn't move, the disc will disappear. You get bones starting to become stressed. They'll lay down more bone, and you'll actually get disc degeneration, which is unreversible. So when you feel neck pain, I tell you right now, is it's not just a muscle issue. If it's, I mean, like, hey, you slept wrong, you woke up, your neck hurts, 2 days later it's gone. Yeah, you stress the muscles, they healed, it's fine. Or if you had an accident or something like that and it heals up in a day, that's different. But if you're actually feeling this on a regular chronic basis, it's not just your muscles, okay? So we go through that process, we do all that exam, we do everything else, and then here is what we come in and we say, okay, now we're gonna adjust this patient and get their spine moving, and then they can do exercises to start to retrain it. So I wanna show you guys how we actually adjust the neck when someone's dealing with something like upper back or neck pain. All right, so we have an awesome patient here. This is Nick, and he's been kind enough to let us demonstrate what we would do with someone with upper back and neck pain. So the first thing I'm gonna do, let's just imagine I've already worked on the rest of his spine. I'm a full spine. I like to make sure everything in the spine is moving the way it's supposed to. So for Nick, now we're moving into this upper back area, and so just let your arms kind of hang to the ground, Nick, cool. Right, and so when I feel his back, the first thing I'm just feeling is like what's moving, what's not moving. And at the same time, where's the muscle changes and tension. Now Nick's a stomach sleeper, so Nick, just kind of turn your head to one side. So he's sleeping all night like that. You can imagine how much pressure that's going to put into the lower neck. Okay, go and look back down. So because of that, he's created a lot of tension. He's also on a computer a lot, so he's got a lot of tension in his upper back. So we're going to release his upper back. First thing I'm going to do is release his left first rib. Okay, this rib locks up and it creates all kinds of tension and soreness through there. All right, so you ready? Cool. Good. Okay, so that's the first rib. Now that's moving. The second thing I'm going to do is help release the upper thoracic spine throughout. Okay, breathe all the way out. Good. Perfect. That was nice and easy, wasn't it? Okay. All right, let's go ahead and lay on your back. So we got the upper thoracic spine, the T-spine, which all those nerves go to the heart and to the lungs, but they also go into the rhomboids in the upper back. And now we're going to dive in or get into his neck here. So this is the part that a lot of people get nervous about because it's the neck, and I get that. I'd be a little bit nervous too when someone's touching my neck. So, but it's actually really light. So we're going to do 2 adjustments. Nick has a subluxation, which means his neck isn't moving properly at C6 and C5. So we're going to release that first, return to the left, and it's just simple, boom. Nice and easy, wasn't it? Okay, and then we're going to get C2, because that's also subluxated. Perfect. Nice and simple. And then I like to traction out and just kind of get everything moving all the way through. That was amazing. Okay, go ahead and sit all the way up, Nick, and face the computer. All right, now these all set up. Next thing I'm going to do is I use this tool. It's called an Arthrostim. Has a nice little edge there on it. And ultimately what we're going to do is help introduce the curve in his neck, 1, but 2, we're going to get full range of motion in each part, each joint in his neck, okay? From the posterior to the anterior, all the way through. Now, this looks like it might actually be painful. So Nick, is this painful?
Not really.
Good. It's like it's full range of motion. The final thing I'll do, because this is all connected, his scapula comes, the muscles to his scapula come through here, and also to his shoulder. So I want to make sure all his shoulders are moving, or both his shoulders are moving properly. So I'll just get in, get a full release there, a full release there. Perfect. And if there's any other things I need to do with the shoulders, I will, but his are fully moving. So you're all set. Good job, bro.
All right, guys, so as you can see, Chiropractic Care is actually very simple in terms of what we're doing, but it's a very, very effective. We're working with the spine and the nervous system. That neck adjustment right there is not only going to help him with neck pain as we go along. We're going to do different exercises to help retrain the body so it stays that way for a long period of time. And that might be a series of care that he needs depending on how bad the pain is. But it's not only going to help you with pain, it's going to help so much more. Your nervous system controls your heart, it controls your lungs, it controls your digestive system. When it comes to sinus infections, allergies, when it comes to headaches, all that stuff, the nerves literally come out of the neck, they go into these muscles, but they also go into the head, they go into all the head muscles, into the sinuses, comes out from the upper back into the heart, into the lungs. You'll see things like asthma and allergies. We'll see things like heart problems from upper back issues. Literally, people with forward head posture have an increased risk of heart and lung disease. That's actually a really huge study they did on men. But then that upper and middle back, those nerves go right to the upper stomach. So that's your gastric esophageal sphincter right there in your stomach. That many times will lead to acid reflux if you have an issue in the back. And that's actually a very, very common area because, look, I'm on a computer, all the way to my head goes into here, and then my head back's bent, so it's all right there. And that mid-back becomes subluxated. And that's why you get the tension there, but that can actually cause digestive issues. And then you go into that middle lower back, that comes into the rest of your digestive system, and lower back is into your legs, your male and female organs. Very important area. So ultimately, and I mean, that's like menstrual cycle issues, that's like ED, infertility issues. We'll see changes with that because of low back issues, which is pretty cool because we're affecting the whole system with just moving the spine. And I want to be clear, I never treated anything. I don't even treat neck pain. I adjust the spine, it removes the interference, it lets the body adapt back to homeostasis, and the body heals itself, and that's why pain goes away, that's why digestive problems go away. I could tell you, I mean, if I took the last, 20 re-exams after 12 visits that we did with people, I would say at least 75% of them, actually I'm going to go back and do this, but I would say it's at least 75% of them put on there, they digest food better and they sleep better. And that's because we help them get back into the digest and rest mode, right? So you can see how valuable it is. Hopefully you learned a lot from this video. I know sometimes we talk about chiropractic, but just showing you, hopefully that helped you see, hey, there's another approach other than medications. There's another approach than going to your doctor, and it's actually very simple and effective. And it only helps bring health to your body. That's your only side effect. Cool? So guys, hope this was valuable for you. Make sure you like this and share it. I want to help people shift their thinking so they can shift their health, but I need you to share it so they can actually see this stuff and start to change the way they think. So do that now. Share that, like it, love it. And if you want help with your health, want help with neck pain, go to queencityhealthcenter.com. We're happy to help you. If you don't live in Charlotte, go to thewellnessway.com, see who you can connect with there, and you can find yourself a great doctor that will help you get better. You guys have an awesome day.
Hey guys, thanks so much for watching this video. If you want to connect with us and learn more, we're constantly shooting information or shooting videos. We actually have a blog as well, and we have a website where you can learn so much more. If you want help with your health, you can actually connect with us, come into our clinic, or jump on a phone call with us and see if we can help you. To do that, go to the links below in the information area and click those areas, and then you can move forward and see how we can actually address and help you with your health issues as well.